Hi, my name is Steven Simon. If this is your first time watching me, I talk about how to live a healthy life with chronic pain, and I want to help you manage your chronic pain. So, today I'd like to speak to you all about chronic pain versus acute pain. So, if you are familiar with chronic pain, you may not, or you may be familiar with acute pain. But what acute pain is, and I'm going to read the definition from the Oxford Dictionary. Acute pain is a type of pain that typically lasts less than 3 to 6 months, or pain that is directly related to the soft tissue damage. Okay, so that would be, for example, if you stub your toe at the end of the bed, or a sprained ankle, or a paper cut, for example. Acute pain is distinct from chronic pain and is relatively more sharp and severe. Okay. Now, the definition for the chronic pain, also from the Oxford Dictionary, is that of chronic pain is often defined as any pain lasting more than 12 weeks. Okay. So whereas acute pain is a normal sensation that alerts you to any possible injury, chronic pain persists often for months or even longer. So chronic pain is long-term and acute pain is short-term, basically. Okay, so that's the duration of it. Now, the location of acute pain is usually just in one area of the body, right? So like I said, if you stump your toe, you're only going to feel that pain in your toe or in your foot in that area. But with chronic pain, you're going to feel it. Like, for example, I have sickle cell anemia followed by avascular necrosis, and I feel pain throughout my body, you know. Also, if you have, I'm just going through my notes here, but if you chronic pain is felt in one or many of the body areas. So in terms of intensity between the two, is that the acute pain is often more intense depending of the cause. So a stump toe may initially hurt, but if I was to slip my finger, you know, cutting an onion or something, that's gonna hurt for a little bit, you know. But then again, like I said, it hurts while the sore is fresh, while it's in the initial stage of the cut, of it being hurt. But long term, you know, an hour later, it's not going to hurt as much. You know what I mean? So, unless it's a hangnail. For some reason, hangnails tend to hurt the most. Like, it's the smallest thing, but they hurt like a you-know-what. Damn. In chronic pain, though, it varies in intensity from mild to severe, you know. So the cause of each chronic pain versus acute pain. Now, the cause of acute pain is usually due to tissue damage, as I mentioned, or injuries, okay? Whereas chronic pain can be caused by many different factors. So, I'm just going to read to my notes here. It's a little bit far from me. Hold on. It says here, it is often conditions that accompany normal aging may affect the bones and joints in ways that cause chronic pain. Other common causes are nerve damage and injuries that fail to heal. Okay, so Also, for example, people with chronic pain, I'm gonna say, is someone that may have cancer, someone that may have a back injury, like a spinal injury. Arthritis is something that someone with chronic pain will have, and nerve inflammation or nerve damage. So inflammation is definitely something with chronic pain, people with chronic pain feel, such as myself. So the other thing that the difference between the two that I want to speak to you guys about is the emotional response between acute pain and chronic pain. Now, with acute pain, the emotional response is usually anxiety or fear in the beginning, you know. Like, I fear that if I get into a fight, I fear I'm going to get hurt. So that's acute pain. That's that anxiety, you know. But that may only hurt for a little while if I get hit, you know. Now, chronic pain, the emotional response with chronic pain is a little bit more intense. You know, you feel irritable. You may feel fatigue, which medication may have to be taken as well. You may feel that you are isolating yourself, that you want to just be alone. You don't necessarily want to be in the space of other people or have to deal with other people. As I said, you feel irritable, so you just definitely don't want to deal with that. Sometimes also chronic pain, the emotional response for that is depression and helplessness. So that's kind of helplessness is that, you know, there's nothing you can do about it. You know, if you have cancer or, arthritis or something, there's not really much you can do. Like, unfortunately, you just do as much as you can to manage it. But, and that's kind of where the depression kicks in, where, you may feel that you're alone and, but you never are alone if there's always someone that you can talk to if you need to seek professional help, if you need to have a friend. Hey, if you need to message me. I do answer my messages in a fashionable time. I will speak to you, okay? The other thing here that I have with both of them is the role of each of the individual with the pain. So, for example, oops, hold on. My meditation music is blaring. So here you go. The role of is on. Okay, so the role with when I say the role, the person with the pain is what I mean with the role. The person with the pain, for acute pain, follows the treatment advice of a doctor. Okay. Or is diagnosed with the treatment, okay? But with chronic pain, you tend to have to manage it yourself, become a pain self-manager with your healthcare provider. Like I said, I have sickle cell anemia and avascular necrosis. My doctor helps with my care, but I'm primarily responsible for, what I do every day to help heal myself, right? And make myself feel better. So that could be exercise, taking my medication. The doctor can prescribe it, but whether I take it, the onus is on me. you know. So that's the difference between chronic pain and acute pain. If anyone has any questions, you know, I'm free to leave it in the comments, and I'll be glad to help answer your comments or your questions. If you're watching this on YouTube, feel free to subscribe. If you know anybody else that may be in chronic pain or acute pain, you know, feel free to share this with them, and they might learn something, or they might need to get help. So I'd be willing to help anyone that's out there in need. And I hope to share and talk to you guys some more soon. Okay, have a great day. Bye bye.